when it comes to especially businesses, I've known businesses I've seen since the CDC made their announcement. Some have signs up that say you still have to wear a mask. Other businesses are saying no masks. From a business owner's standpoint, what guidance should they follow?
We would recommend that they follow the Centers for Disease Control and Prevention. For example, what we've done here at the health department, because we want to encourage those that are fully vaccinated to get back to normal. So our signs will read something like, for health, masks are recommended if you are not fully vaccinated. Just so that businesses, no one's we don't expect people to check people's vaccination history or to confront people. It's really to protect those who are not vaccinated from getting COVID-19.
You talk about the vaccines and you don't want businesses confronting people necessarily. There is some concern. I've heard my neighbors talk about it. That people will, just to be blunt, lie about it. They don't want to be vaccinated, and so fine, I'm just not going to wear my mask now either. From a public health standpoint, is that a concern?
So, from a public health standpoint, we would prefer that people who were unvaccinated wear their masks. We know that COVID-19 is highly transmissible and is highly unpredictable. So, we've got young, healthy people who are hospitalized with COVID who have none of those risk factors of being elderly, having some kind of underlying condition. So, for their health and to avoid spreading it to others who may be vulnerable to COVID-19, we would recommend that they wear a mask.
Let's turn to vaccines. The CDC also recently opened vaccines up to people over the 12 and older. We can do this now in Arizona at most vaccine sites. What do parents need to know? Should they get their kids vaccinated?
So we would highly encourage parents to get their kids vaccinated, especially this 12 to 15 age group. We know that they can get COVID. We also know that they can transmit COVID to others. So I would recommend, if you've got a 12 to 15-year-old, you can take them to any state site. It has to be the Pfizer vaccine. The Pfizer vaccine is the only one that's approved for 12 and above. Moderna and Johnson are still 18 and above. But I just got my 13-year-old immunized and he said he didn't even feel it.
We're seeing more and more vaccine hesitancy, it looks like. The state is approaching 40% totally vaccinated, but those numbers have definitely slowed down. What are some of the things that the State Department of Health Services is doing to reach out to try and encourage people to get vaccinated as those numbers seem to have slowed down?
So you'll see our focuses change a little bit. Initially we were running mass vaccination sites because there was a lot of demand and we needed to get people through quickly. Now, what we reduce any inconveniences or barriers that people may have. So you'll see us now more out in the community and talking one on one with individuals to, talk about any hesitancy that they may have, any fears, answer any questions. And we're also working with private providers because we know that our private providers are a trusted source of information for their patients. So giving them the information that they need in order to be able to answer their patients' questions and encourage them to get vaccinated.